David Treat. I wish that I was a lot, because he's great. Man, it's really good to be here tonight. I can't even pretend that I'll be able to read those lovely notes that I wrote for you. My name is Savannah Kalman. I'm the Prevention Program Manager for Suicide Prevention at the Department of Mental Health and Substance Abuse Services over at 13th and Lottie. I'm about 6 months shy of having a decade's worth of different levels of direct service with people, and I have a full lifetime of living with friends and family who have lived experience in mental illness and substance abuse, and I'm completely bowled over and just humbled by everybody who's been willing to come up and give their stories today, so let's give them just another, yeah. I'm kind of your cleanup batter here, so I also just want to say really quickly, again, a big thank you. How lucky are we that a big, huge organization such as the Oklahoman takes a risk and supports a reporter to do nothing but this type of investigative, illuminating reporting on mental health in Oklahoma. So thank you to Kelly Dyer-Fry and to Jacqueline again. Yeah, thank you. So I'm going to give you a few facts that I'm sure some of you are already very familiar with, and then these are all global facts, and I want to start off just very quickly by saying that these numbers that I stand up and repeat in trainings, it is never lost on me that these represent individuals, right? So sometimes when you hear a lot of data and facts, you kind of wonder, man, does that person know that, like, that's my aunt, or that's my cousin, or so on and so forth, that's me? I feel that a lot in these numbers, but I want to share with you globally some of the things that are going on in our state. So in the state of Oklahoma, the CDC classifies youth as 10 to 24-year-olds. Talk to them if you feel like youth is something different. So youth is 10 to 24. For 10 to 24-year-olds, suicide is the second leading cause of death in the state of Oklahoma. It's number 2. Across that entire age range. So for working age adults, the CDC classifies working age adults as 25 to 64-year-olds. Again, talk to the CDC if you worked before the age of 24 or after the age of 64. But for working age adults, 25 to 64, the national rate of death by suicide per 100,000 persons in the nation is 12.7. For 25 to 64-year-olds, the rate of death by suicide per 100,000 in the state of Oklahoma is 24.9. We're double the national average, and our working age adults are really struggling. For many years, we've had youth-appropriated suicide prevention, specifically being there for the needs of our middle and high school students in particular, because of the information we receive from the Youth Risk Behavior Survey that says somewhere between 12 and 15 ninth and 8th graders, 8th grade and juniors in high school are having active thoughts of suicide within a calendar school year. So those numbers are high, and we know that our youth need attention, we know that they need services, but now we're really starting to understand that people across the age range in Oklahoma are really struggling. The problems that are facing these individuals who go on to take their lives are largely mental health concerns that are not addressed and intimate partner problems. When you select for the age group that is a little bit older, chronic pain and disease starts to become a primary presenting problem. And when you go to the younger ages, it is more and more often intimate partner problems, which you can imagine that is another kind of CDC term that covers a multitude of things, right? That could be anything from an abusive family situation to a person who you've been in a relationship with that has been broken. So why come at the end and just really wrap things up with a bunch of like very, very hopeless statistics? It's because the last thing I want to give you with is that over the last 2 years, as we've seen an increase in suicide prevention funding, both from winning 1 in 4 awards that are available in the entire nation, Oklahoma has one of them. This agency is a machine that is very lean, full of very smart people, and we are 1 of 4 in the nation that receives funding for those 25 to 64-year-olds. We won that grant this year, 1 in 4. And then our youth funding continues, and we're out there in the community. But, you know, like, you don't have my job, so what are you supposed to do, right? Like, you don't want to listen to me describe to you what I do all day. What can you do? What you can do is you can do something for me right now. It's going to make you really uncomfortable, but I need you to spend 10 seconds and look at your neighbor and say, are you thinking of killing yourself? And then I want you to have them be able to say it to you. This is going to be uncomfortable, but we're all here having coffee. Maybe somebody back there has had some extra coffee. So go ahead and give me 30 seconds. Ask your neighbor. All right, this is going to be just like whatever your version of church is. So I also want you to go ahead and take a moment right now in this moment of maybe discomfort or maybe comfort if you're a clinician or someone with lived experience. But I want you to now turn to that person and say, I care about you. You could call me if you were ever struggling. So go ahead and say, I care about you. You could call me if you were struggling. And I hope you mean it. This is where I slowly just walk off the stage and you forget that I'm up here. Okay, thank you guys very much. So there are a lot of metaphors for what we just did, and sometimes when I give up and give trainings, I can kind of see people feel like, no, that can't possibly be enough. But what you just did really is enough. Letting somebody know that you care enough that if they were ever struggling with thoughts of hopelessness, feelings of worthlessness, feeling like they are a burden, whether or not you are having those same thoughts about their situation, I may think that what Jacqueline's going through is not that bad, but if she's telling me and giving me the signs that she's really struggling, I need to be there to listen to her, and I need to be able to let her know, not just when she's in crisis, but I need to let her know tonight, Jacqueline, I really care about you, care about the work that you're doing, and if you ever needed to, I want you to call me. And if I wasn't around, I want you to be able to call my partners back there at Heartline because they're available 24 hours, 7 days a week. If you need to talk to somebody consistently, I want you to get hooked up with NAMI. I want you to get hooked up with one of our CMHCs. I want you to find one of the peers that are in this room that are beautiful, amazing people. I want you to continue to tell your friends and family members that no one up here tonight had spots or 3 arms. These are your friends, these are your family members. I have a spot right now actually, but like not like big purple spots. These are your friends, these are your family members. And mental illness does not deserve the weird stigma that we attach to it. We do not talk about this the way that we do about medical disorders. When I have a neighbor or friend who has a flu, I provide them maybe with some soup and call them, make sure they're okay. We need to do the same thing when one of our peers who was just up here is having an episode, right? So when you are able to tell someone when they're not in crisis, I care about you, I want you to reach out, I want you to let me know if you ever are struggling, and then when you see it, having the very, very brave conversation and saying, are you thinking of killing yourself? And then being able to provide them to those resources, that's going to be met with relief from that person. And if it turns out that's not what they're struggling with, they're going to be able to answer you honestly and say, no, that's not what I'm going through, you know? But they're going to know that you cared a lot. I know this felt weird to maybe go through the motions tonight, but hopefully some of you sensed that person was willing to feel a little awkward to make sure that I knew that they cared about me. And those brave conversations are going to be able to transform our state. Until I have more money, until I have more staff, until I have more resources given to me in all directions, I'm not going to be able to do this by myself. So I really need you to be able to have those brave conversations. The only other brave conversation I would ask you to have is to please email or call your legislator, right? Please, yeah, let's go ahead. Please share with them tonight's stories of recovery. Recovery works. These people are lovely and they are living in recovery. They are just a few of many, many Oklahomans who are putting money back into our state, who are giving of themselves to other people who are still currently struggling, and who are assisting the department when we fall short because we have so many limitations put on us, are out there really just providing a community response and helping Oklahoma be a place worth living in and giving some of those reasons for living back to one another. So please call them and share with them the stories that you've heard tonight and hold them accountable for what are we doing here that we're not being able to fund mental health in the ways that are really going to provide recovery. So have some brave conversations. Thank you so much. I'm here to just say that we work for you. We work for you. We work for these individuals. I come every day thinking about your hearts and your minds and trying to get you the help that you deserve when it's your friend, when it's your family member, when it's you. So if you ever needed to know anything more about what the department's doing, we're able to connect you with our communications director, or I'm going to be around for a little while afterwards. But we work for you, and we really care about everyone who's here tonight and everyone in the state. So thank you so much.